Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter R. I started respiratory disease yesterday, talk about upper respiratory tract infection, and I just like to make addendum for previous video. Is about since the season is really coming soon, regardless. So the flu vaccine is recommended for all the age groups actually, with or without risk factors. But for those who particularly have high risk factors, comorbidities or other respiratory system disease or advanced age group, for those people above 65, really strongly recommended. So this is the flu season is coming, so I just want to mention on this video. And today I'm going to talk about the respiratory failure. Let me just bring up this emergency situation. Definitely it's emergency situation. However, for those healthy, without serious disease, without any medical problems, the respiratory failure is not commonly occur. So the respiratory failure occurs with the previous pre-existing conditions like severe COPD caused cardiopulmonary heart failure, or majority of cases the respiratory failure is a part of the multiple organ failure or part of the systemic diseases. So the isolated lung disease can cause the respiratory failure. Usually, like I said, the COPD, advanced stage of COPD, or really elderly with aspiration caused a special strain of bacteria infection, particularly gram-negative rods. Part of sepsis causes this respiratory failure. So the emergency situation, definitely if you gasping for air, blue cyanosis and difficulty breathing, or foreign body aspiration. So if that's the case, emergency situation definitely. But however, usually it occurred in the hospital setting actually. Patient admitted for some serious diseases and developed multiple organ failure, and respiratory failure is part of it. So as a matter of fact, isolated lung disease, like I mentioned, cause the respiratory tract failure is not that common unless I mentioned advanced stage of COPD, advanced stage of cancer, lung cancer, or other advanced interstitial lung diseases, which really at the end stage your doctor probably already mentioned to you what kind of signs you're looking for the respiratory failure. Usually the respiratory failure is part of the other systemic diseases, or like for example the multiple organ failure caused the respiratory distress syndrome. It's particularly caused by the gram-negative rods, sepsis, and then shock, and then multiple organ failure, then respiratory distress syndrome developed. So these are just the usually occur in hospital settings. For those people had risk aspiration, for example, older people lost consciousness for whatever the reason, either stroke or alcohol, and then aspirate and not treat in time fashion and develop the severe diffuse lung infection and sepsis, and then develop respiratory failure. That is probably one of the common causes I can think of it. And also, like I said, the sepsis causes multiple organ damage or injury, cause the shock, either hemorrhagic shock or endotoxic shock, and cause this multiple organ failure. So respiratory failure is part of it. In terms of the severe infection cause this respiratory failure, it's also another cause because of the infections by either viral infection or bacterial infection. The viral infection usually for healthy people probably is not, respiratory failure is not the common outcome, but nowadays since the immunization or particularly the immunization really prevented a great deal of those respiratory failure. In terms of the bacterial infection, I mentioned gram-negative or special strains of bacteria cause this respiratory failure, particularly for the comorbidities, some other diseases, either over obese, over weighted to the obese and bedridden patient, or stroke, or alcohol, loss of consciousness. So these are really the risk factors for the respiratory failure. In terms of preventive, of course, immunization prevent for the pneumonia infection for older people is another common cause. So get the pneumonia vaccine. So for those older than 65 years old, or younger if you have other diseases based on your physician's recommendation. And also for the stroke, people with stroke are difficult to swallow. For those, I think either the therapy of the special therapy to recover, like a rehab, and at the same time to prevent the aspiration sideways lying, for example, is another way to prevent the aspiration. And for those tend to have this lost consciousness with the alcohol, so that's the really there's no other way, just the behavior manage and do not drink that much. Or if you think you drink too much, then you sleep sideways. So prevent the aspiration. That's all I can think. For those who had systemic disease, obese, diabetes, hypertension, obesity actually, it's another risk factors for the respiratory failure, because I saw a lot of time the ICU intubated patient obese, very large of body mass index that's impaired respiratory function. So the respiratory failure probably either one of the part of the multiple organ failure, or some other organs not function well. So this is about the respiratory failure. It's like I said, it usually happened in the hospital settings for the ambulatory. If you have been healthy, usually it's not commonly seen unless there's some special cause like aspiration or the foreign body or the injury. Usually it's not that common. But the take-home message for this video is for those who had systemic disease. Either you think I have kidney disease, or is far from lung, but never thought about kidney disease can cause the heart failure, then can cause the respiratory failure. It's also quite common actually. It's not uncommon. So any of systemic disease, particularly for advanced age people, really need to pay attention the sleeping position, and also talk to your physician to prevent aspiration cause the deep lung infection, cause respiratory failure. So I'm going to stop here and hope it helps, and or hope it will trigger your interest to search more and to find more. So I'm going to stop here, and thank you for watching. I will see you next time.